colleagues, classmates, respectful Arapagos. I'm going to thank you very much for giving me the opportunity to share with you some information about dental service in Kyrgyzstan. But before, let me in a few minutes introduce my country, Kyrgyzstan. Kyrgyzstan is a young independent country, one of the former Soviet Union republics. This is our flag and national emblem. Kyrgyzstan located in Central Asia between Kazakhstan, Tajikistan, Uzbekistan, in China and the south. This slide shows how we are located on the globe in the center of Eurasia. Kyrgyzstan is only parliamentary republic with first woman president among CIS, it's Commonwealth independent states. As you see, we have three main ethnic groups, Kyrgyz, Uzbek and Russian. And we have two official languages, Kyrgyz and Russian. Because Kyrgyzstan, 95% of territory of Kyrgyzstan is mountains, we have many beautiful mountain peaks, mountain glaciers which feeding mountain lakes. This is the most famous Kyrgyz lake, Isykyl, which means hot lake, because it's never frozen even in winter time when temperature can be minus 20 Celsius. Before I came here, I spent a few months in English pre-training course, and one of my instructors asked me, Talant, tell me something about your country, what I cannot find in Wikipedia. And I would like to tell you that two points about Kyrgyz people. The first one is Kyrgyz people are not punctual. If you invited for your lunch, for example, at 6 p.m., you don't have to come exactly at this time. You should come 1 or 1.5 hours later, because if you come at time, your host family can say, oh, these guys are very hungry. And next we have a legend. When God created a world, and when he was distributing lands for nations, smaller or bigger, Kyrgyz people was as always late. And when they come to God, he didn't have nothing for them, but just only this place which he kept for himself, like a vacation place. And he had to give us this place, so now we are living in God's fazenda. This is our capital, Bishkek. It's modern city. Kyrgyz girls, and they are after 50 years. As I said, Kyrgyzstan was a part of Soviet Union. Usually, people in the United States know about Soviet Union in terms of some political or military issues. Usually, it's they know about Red Army, Cold War, Perestroika, and maybe two famous in the world Soviet persons, Lenin, who established Soviet Union, and Gorbachev, who destroyed it. But usually people know nothing about healthcare in Soviet Union. What does characterize Soviet healthcare? It was free access for medical care, prophylactics, and dispensarization. I couldn't find this word in Russian English dictionary, dispensarization. what is this dispensarization? Dispensarization, it was a state program to examine and to register people, patients who had some chronic disease. This process could take a few years, and after they get a treatment and after recovery or a significant improving health condition, they were taken off from registry. In Soviet Union, in my opinion, it was a good level of education with high standards. But the problem was its low financing, because most of financing, most of money, Soviet government spent for military purposes, and not good level of medical equipment. Yes, but the previous, yes, thank you. And after when the Soviet Union was collapsed, we had many challenges, many problems in political, social, and economic spheres, and healthcare in not exception. So, what does characterize healthcare in independent Kyrgyzstan? Officially free medical care. Why I use the word officially? Because by our constitution it's free service, but usually when people come to a hospital and need to get some treatment, hospitals cannot provide all medication for patients, because again of poor financing, and the patients, and usually doctor after examination just write on the paper a list of medication which this patient needs, and he or she or his family members has to go to pharmacy, bring it and buy it and bring it back, and after that patient can get a whole capacity of treatment. But the difference between Soviet and Kyrgyz healthcare is possibility or availability to get service from private service, which was impossible in Soviet during Soviet Union. Again, private medical service can offer for patients better level of dental treatment. Of healthcare service in terms of equipment, in terms of some components, because they have owners, some businessmen or some commercial structures. Now we are losing these programs like prophylaxis and dispensarization, again because government cannot finance it. And next one. And dental service as a part of healthcare face some problems, which you see in previous slide. Mainly free dental service. Most of our patients go to dental public dental clinics. We have a network of public dental clinics which cover the whole territory of Kyrgyzstan. But the problem is, it's again about fashion equipment. Some equipment is work from Soviet years. limited choice of materials, but fortunately now people can choose between private and public clinics. On this slide, you can see two clinics. This one is private clinic. This one is public clinic. I work in both of them, and on this slide you can see how equipped private clinic and how which is equipment in public clinic. For example, this dental chair is maybe like 22 or 23 years old. And outside of clinic, this is public clinic, first floor. Next, please. In our public dental service, we recognize 3 levels. The first primary level of dental service is some kinds of dental service, like training of oral hygiene, prophylactic examination, and various basic methods of tooth treatment. And all dentists and graduate students can do it. People can get this level of dental service everywhere, in dental hospitals, departments, and dental rooms, in schools and kindergarten. Second level includes capacity of first level of dental service and some advanced methods of dental treatment or dental or oral surgery, like extraction of wisdom tooth or cystectomy, which is my favorite operation. And in addition, we include in second level basic methods of implantology and orthopedics using implants. And third level of dental service, high specialized. It includes capacity of first and second levels, plus some complicated, plus treatment of some complicated cases. In this level, we use high-tech technology like dental lasers or microscope, and of course it's maxillofacial operations and maxillofacial orthopedics. Net of public dental clinics contains 37 dental clinics, 21 departments in hospitals, and more than 100 dental surgeries or rooms, as I said, in schools, in kindergarten, in factories. Three maxillofacial surgery, one maxillofacial center in capital in Bishkek, and 2 departments in regions. And the Institute of Dentistry, which is part of a branch of Kyrgyz State Medical University. On this slide, you can see some basic indicators of dental service, but I should say it's regarding only public sectors. We don't have statistics about private dental service, and I will tell why later. As you can see, we have during last years we have almost the same numbers of tooth fillings, and in my opinion, huge number of tooth extractions. Patients especially in rural areas, they prefer when they have a tooth pain, they prefer just extract it because they don't want to spend time, to spend money. They think it's easy, but actually it's not always easy just to extract teeth. And in this line, which show percentage of patients who were sanitized, it means after all treatments, after surgery, fillings, and orthopedics, they don't have nothing more to do. But personally, I don't trust these numbers. Why? Because our directors of our public dental clinics, they have like plan, and they cannot write or show real number, because if this number will be less than 50%, they can lose their job. This is our personnel. Last year we had 1,500 dentists, which is 10% of medical personnel in Kyrgyzstan. And personnel, this is our national target. We try to reach this number, 3.5 dentists per 10,000 population. In Soviet Union it was a little bit bigger. And this is what we have in real. We have over the norm in capital, in Bishkek, and Naryn and Jalalabad. It's rural areas, big rural areas in Kyrgyzstan. So you can see we don't have enough dentists for population. Why again? When students graduated at the medical university, they don't want to go to rural areas because of life condition in rural areas, and because of salary, because of people usually cannot pay enough money for dental service. And structure of dental service in Kyrgyzstan. We have two main institutions which look over dental service: Ministry of Health and Dental Association. As you see, private dental sector doesn't connect directly with Dental Association. What I mean, for example, all dentists who work in public dental sector, they are members of Dental Association. And just a few clinics member of Dental Association. Ministry of Health, they depend from Ministry of Health in terms to get a license, and in terms of sanitary conditions. But Ministry of Health or private dental sector doesn't write a report to Ministry of Health in terms of statistics. I don't know why. So we don't have a real statistic, a real information about private dental clinics. The main institution which offer dental service in Kyrgyzstan is a public dental clinic. The structure of public dental clinic includes administration and 3 or 4 departments. And also orthopedic department, orthopedic include tech laboratory. Average of amount of staff in public dental clinics is like 16 or until 100 persons. Dental Association of the Kyrgyz Republic, which I represent, is a young non-profit organization established 12 years ago. We are a member of World Dental Association and European Regional Organization of FDI. And we organize annual congresses and some processes in organizational issues like attestation and clinical accreditation. And with cooperation with Ministry of Health, we do some certification of dental materials and equipment, and we try to keep prophylactic programs. In summary, I can say that in dental service in Kyrgyzstan, the prevention now is not a current focus, and poor financing, but as a developing country, we unfortunately we couldn't spend enough money for dental service, for public dental service. As I said before, we don't have enough specialists in rural areas. Solutions Dental Association offer to develop creation programs, maybe with cooperations with some international organizations. Actually, we don't need to develop something new. We just need to maybe rebuild prophylactic programs which was in Soviet Union, and create the mechanism of specialist distribution in rural areas. For example, how it was when I studied at the university. After we graduated, we had to go to rural areas for 2 years. And after 2 years, maybe half of us come back. Why? Because during 2 years, new young specialists can be married, new friends, job. They bought apartments, houses, and it was one of the ways to provide specialists in rural areas. And we offer establish a national dentistry coordination body. In Bishkek, in our capital, we have 5 public dental clinics, and we offer to transform one of them as a national dental center, which will be coordinate private and public dental service, collect and analyze national data, and monitoring and evaluate dental service. Here at the Tulane University, I focus on some organizational issues like certification, accreditation, and quality improvement. And I hope after half a year, I will be able to offer some new ideas to improve dental service in my country. Thank you for your attention.